Hi, this is Dr. Scott Morris. I am the medical director of Eye Consultants of Colorado in Conifer, Colorado. So we live in the mountains, and so a great many of our patients suffer from dry eyes, irritation, fluctuation in vision, and the big one, which of course is red eyes. And we know that that's usually related to ocular surface disease. So much so that we've built our practice around that. Many doctors ask me about how blepharitis is it really that big of a deal? And the answer is, I don't think you're asking the wrong person. I think what you should do is ask the patients that sit in your chair. For many of them, their eyes are red, they're irritated. They have people who say, gosh, all day long people ask me why my eyes are red, if I'm sad, if I'm crying, what's going on? And the reality is this is blepharitis manifesting itself as symptoms that affect people's everyday life. And if we can change that where they feel better about themselves, that's what we're meant to do. As doctors, our job is to provide a better quality of life. And by treating their blepharitis, we get to do that. Before Blefadex came out, we tried many things. We were using diluted tea tree oil shampoo, we were doing hot compresses, we were doing prescription antibiotic ointments and drops, and whatever's the most appropriate form of treatment for our patients. And when we found Blefadex, we're like, cool, we got the holy grail. We now have a really homeopathic way, if you will, that's very effective and very powerful to treat multiple forms of blepharitis, from Demodex to bacterial bleph. So often we hear the question of, well, does dry really impact people? And the answer is absolutely. If you ask the right questions about how, instead of asking the doctor, maybe the doctor should ask the patient. So what types of things do you experience every day in terms of your eyes being red or irritated or fluctuating vision? And what you often hear is people saying, oh, I can't focus at the computer for very long. I find myself having to take a lot of breaks and then I lose focus. Or I find myself having to use artificial tears and then reapplying my makeup. These are all things that impact not just their focus, but largely their quality of life, of what they'd like to do versus what they're able to do because they're suffering from different forms of blepharitis.